The link between sleep and cancer risk can't be ignored as healthcare professionals continue to sound the alarm. One of those most concerned is WebMD's chief medical officer and author of the book, Take Control of Your Cancer Risk. Dr. John Whyte joined me for some true or false when it comes to sleep. All right, well, the first question is, you need less sleep as you get older. Is that true?
It is not true. It's this idea that, as typically as we get older, especially, when we retire in our late 60s, people think, oh, you need to sleep, 10 hours. Our sleep needs don't change much over time. It's 7 to 9 hours, typically through adulthood. It's different, for adolescents and young folks. The quality of our sleep does drop off as we get older. We don't get as much of that deep sleep, but it's still about 7 to 9. And I tell people, if you're an adult and you're sleeping 10 to 12 hours every night, often poor sleep, if you're sleeping 3 to 4 hours, is a measure of something else going on with your body. Some other health issue. It's often the first sign: depression, thyroid disease, other issues, diabetes.
That's really fascinating. I'm assuming if you can't sleep and you keep waking up, that's the time to go see your doctor too, right?
Absolutely. Don't try doing it for years at a time and self-medicate. You may have an underlying health issue that is your body telling you, hey, there's something else going on.
So good to know. All right. Number 2, working at night increases certain types of risk of cancer.
It does. This is that shift work. If you work at night and then you don't try to ensure that you get quality sleep, it's typically cancers associated with hormones, prostate cancer, breast cancer. That's where we've been seeing the increase in shift workers.
Interesting. Question number 3. Melatonin can help prevent cancer through sleep.
Melatonin does have a good value in terms of that sleep-wake cycle. So melatonin levels increase at night. That's what helps you fall asleep. And cortisol levels increase in the morning. That's what helps you awake. And the issue of insomnia, those often get messed up. So there is a role for melatonin. Now, my caution is we don't know if taking supplements help. So I don't want people to go out and, buy a jar of melatonin tablets. We don't know if that's the case. But maximizing normal sleep, melatonin has a role in that, is going to help you reduce your cancer risk.
Got it. I took melatonin once and I felt the next morning like I'd been on a bender. So I haven't tried it again. This is one thing I am the queen of.
Okay.
Hitting the snooze button.
Yeah.
Is it okay? I mean, what are the implications of that? Because I do it every day.
Now we're doing it on alarm clocks. I mean, now we're doing it on our watches.
I know. And by the button,
clock.
I mean the phone.
Yeah. No, what it's telling you is that you're doing something wrong, that you're not setting your time right in terms of number of sleep that you need. You're thinking, I only need 6 hours, or I can get by with 7, and you need 8, because that's what we just talked about. That's your body telling you, I need more rest. And here's the thing. If you wake up in the middle of deep sleep and you hit that, you don't just go straight back to sleep. You're not actually getting a lot of benefit from hitting the snooze button. What I'd rather you do is go to bed a little earlier to try to get more sleep and better quality sleep.
Okay, copy that. I'm going to try.
And it takes work. You should also remember, it doesn't happen the first couple of times. It can take 7, 8, 10 times before you develop a new habit, because you had a bad habit, I'm going to be honest, of pressing the snooze button, and you kind of have to reset it. You got to focus on sleep. And the great thing is there's so many good apps out there to help with tracking sleep, looking at the quality of your sleep, and then trying to figure out what are the strategies to help you sleep better.
Okay. Last true or false question. Right. Taking naps during the day will help me sleep at night like I'm a bitty baby.
There is some mixed data on that, but in general, taking naps doesn't help you sleep better at night. And the reason why is particularly if you do it after 3 o'clock or 4 o'clock, because it's coming too close to your bedtime.
Okay.
Now, there's some data that, perhaps if you're doing it around noon, it might help. But overall, I don't recommend napping to most people. That our bodies don't really need a nap for getting quality sleep. If you're needing a lot of naps, sometimes that's due to obstructive sleep apnea. that's a warning sign.
Mm.
Other times it's you're not getting enough rest to begin with. So, a nap here and there isn't going to be bad, but in general, taking naps every day is not a good way to maximize quality sleep.
And there you have it. We always learn so much from Dr. Whyte.